Hey everybody, thank you for joining me today. My name is Eric Johnson from Movement Revolution. I'm happy to be joining you today for MSA Awareness Month, along with the MSA Coalition. I'm here to talk to you about a topic I am extremely passionate about, something I've devoted my career toward, and that is living stronger every day with multiple systems atrophy, or MSA. Let's get right into it. A little bit of background about myself. I've been in this field and started my career in the adaptive exercise and physiology world back in 2009 when I had the pleasure of working at one of the top rehab hospitals in the country, the Rehabilitation Institute of Chicago, which is now the Shirley Wright Ability Lab. Since my time there, I've had the pleasure of working with over 1,500 people affected by neurological conditions, including MSA, Parkinson's disease, and other atypical Parkinsonisms. In 2013, I saw a need for exercise-based services, post-therapy for people living with neurological conditions just outside the immediate downtown Chicago area, which spurred me to start my own company called Movement Revolution. Since 2013, we now have 5 program locations around the Chicagoland area, along with other virtual services that we offer as well. One of the programs that we offer here at Movement, I'm sure you guys may have heard of it before, but it's called Rock Steady Boxing, and we opened up our Rock Steady Boxing chapter in 2015. And most recently, one of the things I'm very proud of is providing our community with professional exercise resources so that people are working with someone who is very educated on the different conditions that we see. They can be complex when we really have to know what goes into the diagnosis, the symptoms, and how do we program and prescribe exercise for those individuals. And we created a neuro exercise specialist training protocol for all of our staff here at Movement Revolution. And the Parkinson's Foundation actually accredited our exercise educational program in 2022 as a part of a pilot initiative to start to accredit exercise education programs for Parkinson's disease and atypical Parkinsonisms. So here's a list of some things I'd like to discuss with all of you today. We'll start with a little brief introduction on MSA. I think most of you attending this presentation today certainly know the disease well, but for those of you joining us maybe on a recorded version of this, I want to make sure that we cover some of the basics and the phenotypes, the symptoms, and the presentation of multiple systems atrophy, just so we have a good basis to work from when discussing everything else. We're then going to go through a very brief research review that looks at what has been done on the side of research and exercise for MSA, and then how do these exercises help manage MSA itself. We're going to talk about how to establish a multidisciplinary team, which is incredibly important for anyone with a medical condition, but particularly with MSA. There are a lot of resources that are available, hopefully in your community, if not virtually. And how do we kind of put those pieces of the team together? That's what we'll talk about there. And finally, the most important thing, exercise, and how we functionally apply that exercise at home to help you and your loved ones live stronger every day with MSA. So what is MSA? It is a rare progressive neurological condition with a mean onset of 50 to 60 years of age, so they consider it a prime of life disease. It affects roughly 13,000 people in the US. However, that number is probably drastically underdiagnosed or misdiagnosed, just due to the nature of there's a lot of overlapping symptoms with other movement-related disorders or neurological conditions. That number is likely higher. But the initial symptoms include a combination of motor and non-motor symptoms, or autonomic dysfunction is a big one that may show up prior to the onset of some of those motor symptoms. But like Parkinson's disease, a lot of times people are diagnosed with Parkinson's disease before they're diagnosed with MSA. But like PD, MSA affects the cells that produce dopamine in your brain, which affects your motor control and movement patterns. Commonly, people with MSA have a poor response to those commonly prescribed Parkinson's medications, such as levodopa. So that is not, if you're a poor responder to those medications, that is not an indication that you have MSA. However, most people with MSA do have a limited response to those medications. So there are two different phenotypes commonly associated with MSA. I just wanted to go over those quickly, just to kind of identify what some of the differences might be between the two. Maybe your doctor has talked to you about these before, maybe they haven't, but just wanted to make you aware of them. First one, MSA or cerebellar. So what we typically see with that is people with trunk and postural instability, a lack of motor control or upper body and lower body, kind of more extremity-based ataxias are very common with someone of this type of MSA. I typically see like a wide stance or wobbly gait, kind of a tipping back and forth as someone were to go to walk is something that we would see as well. And then cerebellar ataxia, I think that's something you briefly just discussed, but it's kind of the lack of motor control or the lack of control with kind of the distal extremities. So your hands might shake and kind of be harder to control. Same thing with your feet, so it might be hard to initiate those steps. Someone with this phenotype of MSA will typically have more motor control symptoms or more motor symptoms associated with it. And they might also experience what we call scanning dysarthria. So that is kind of a speech impairment that is kind of like a word finding, or you kind of stumble over words. So communication can be a bit of a challenge for someone in these conditions. I think those are really things that we want to be aware of, because as we'll talk about here in a little bit, establishing that collaborative care team, speech therapy is a big part of that. And someone with MSA-C might be someone that might be needing to utilize those resources a little bit more than someone with MSA-P or Parkinsonian MSA. So with that phenotype, we typically see more Parkinsonian-like symptoms, the bradykinesia or the slowness of movement, rigidity, immense stiffness of your muscles, maybe hard to bend and flex your legs as you're going to sit and stand, or when you're initiating a gait pattern. Balance and posture might be an issue, so maybe tipping really heavily forward on your toes or really far back on your heels. It might be hard to distinguish kind of where that center is, where that midline is. You might be more tippy with this phenotype of MSA. Falls can be more prevalent. They typically are more prevalent with MSA, and that's something we really need to be aware of, especially as you're becoming active and exercising, as well as establishing that care team, is monitoring falls and kind of making sure that we're staying on top of how we can limit those as much as possible. Someone might have a predominant type or phenotype, but a lot of times the symptoms will overlap over time. So as I mentioned before, MSA will affect some of those dopamine and more motor control symptoms. You'll kind of see that translation kind of cross these different phenotypes. But we'll talk here next about overlapping symptoms, kind of what we look at and kind of what we take into consideration especially when prescribing an exercise program. So this is a slide I love to show because this is one we show all of our coaches and all of our volunteers because I think it encapsulates not just the things that we typically see when someone's affected by these conditions, but there's a lot of things going on, both autonomically, so or non-motor symptoms, things that we don't outwardly see, but someone with MSA certainly feels. Sometimes before these motor symptoms even take place, these are all the symptoms that could and maybe affect someone with MSA. Not to say that they have all of these, but I think it's important that we identify what are some of the common disturbances with someone affected by this condition. And I think, as we talked just briefly in the last slide, bradykinesia, rigidity, postural instability, gait disturbances, and balance, these are all things that affect the motor movements of someone throughout the day, right? So these are the things that make it harder to move outwardly, making it difficult to do a lot of activities of daily living. However, there are a lot of these non-motor symptoms that we need to be significantly aware of, because those directly impact how your body moves the next day, as well as they may be happening more internally, which we do not see, but it's very important to establish that line of communication with your client, your family member, to make sure that we understand how they're managing any kind of depression or anxiety, whether that's related to their condition, symptoms, fears. I think those are things that we really take into consideration when looking at an exercise program, because we want to try to minimize those as much as possible. Take the fear away from movement by prescribing exercise the right way is really, really important. And a skilled professional, skilled therapist can really help you with that. We will often see kind of more autonomic dysfunction or blood pressure regulation is a big thing. So feeling lightheaded and dizzy, especially when sitting and standing or getting up from a lying position, that is definitely something that we want to be aware of. Visual disturbances can also be a challenge. So eye tracking, changing in head positions while moving, it can be a significant balance concern, but still something we want to work on, right? I think these are things that certainly affect you day in and day out, but they're all things that we can address and should be addressing in an exercise session. So kind of overarching message here is what's above the water is like an iceberg, right? What's above the water are typically things that we see, but everything below the water is typically those non-motor symptoms. That's what people with MSA really feel. And I think that's a really important point to understand, whether you're a care partner, a health professional, or someone with MSA, is making sure that we're understanding and opening a line of communication to discuss all of these symptoms as we go to become more active. Now we'll move into discussing how do we proactively create a care team for those with MSA. It truly takes a team, so we're going to kind of outline what that team looks like. As we just mentioned in the last couple of slides, the symptoms can be varied and complex with someone with MSA, which makes it incredibly necessary to establish a really strong, comprehensive care team to help create a multidisciplinary approach to your proactive care with MSA. So these are all the different clinical specialists or non-clinical specialists that we recommend our clients are in contact with. And if you're not, we can help you get in contact with these folks, or talk to your doctor about how you can establish these different members of your care team as you go and move throughout the diagnosis. But one thing we strongly recommend is that all of our clients seek out a movement disorder specialist. That is a neurologist who has additional training on movement-related disorders specifically. And that might not be possible in all cases and scenarios, depending on where you live. However, if you do have access to someone who does have that movement disorder specialist designation, we strongly recommend that. They're just a little more educated on the latest research, and especially with some of these more atypical movement-related disorders, they tend to have a larger breadth of knowledge in those areas. Other members of the team, a licensed clinical social worker. Have someone to talk to, whether it's the person with MSA navigating some of the emotional challenges and those non-motor symptoms. It's a really important line of communication to establish, so you have a voice outside of just your family members. We all know how that can be, and maybe that's a good conversation to have with that social worker, is a joint discussion about how we can best communicate and how we can best advocate for our loved ones with MSA. We talked a little bit about some speech disturbances, some swallowing issues that might impact folks, and I think seeking the consult from a speech therapist can't be underestimated. I think it's one of those more underutilized therapeutic interventions. Help with speech, swallowing, communication, cognition. There's a lot more than just amplifying the tone of your voice. It's much more comprehensive than that. Physical and occupational therapy are hopefully pretty standards of care for folks with MSA as you get more into the disease process. But seeking therapists in all aspects here that really specialize in neurological conditions is always ideal. It's not always going to be available for you depending on where you live. However, if your therapist isn't as educated or as versed on MSA, help provide them with some of the information from the MSA Coalition or other resources such as this, to see how they can become more educated on the condition that they're trying to help you with. So, but physical therapy, obviously, that's going to be helping prevent falls, deal with any acute injuries or acute situations that you might want to establish and become better at. Occupational therapy, again, kind of one of those more misunderstood and kind of underutilized therapeutic interventions. helping with the fine motor skills, helping you get in and out of the car easier, helping you get in and out of bed easier. These are all like quality of life, daily functional tasks that an occupational therapist can really help you with. It's not just the fine motor manipulation. It should be and can be, how do you navigate more safely around your house, and how do you complete those activities of daily living with more ease and better, tactics, right? Community support organizations, support groups, exercise classes are huge in just establishing a social support network. I think whenever we work with a lot of our clients affected by these neurological conditions, as you get older, as you progress through the diagnosis or just living with it for a longer period of time, communication and social settings might change, and that social interaction is incredibly important for your mental health and cognitive health, along with your physical health. So seeking out those community support opportunities and organizations, and reach out to those organizations to see if they can help you find some resources around you, is incredibly important. And finally, I'm a little biased, but I think seeking out a neuro exercise specialist is also incredibly important. I've placed an immense amount of responsibility on all of our coaches and any exercise professional out there working with people of a neurological diagnosis, because we see our clients on average 100 to 150 times a year, depending on how frequently they come in. And that is probably the most touch points that a health professional has with someone with a diagnosis, right? I mean, you typically see your doctor a couple times a year, maybe every quarter. You might see a physical therapist for 16 sessions or 6 weeks, but after that you're kind of left on your own, and you don't see that person again until you have to, which probably means you've had some sort of progression or an injury. So the role of an exercise professional, the role of getting active and maintaining active with an exercise program, has another person advocating for your health to make sure that we're monitoring the ebbs and flows of your week to week and your month to month successes and challenges, right? And that person should be in contact with your clinical team, and it should be a very integral member of that clinical team. Just like we are here, I hope that you can find those resources near you. And I think with this team, we want to be as proactive as possible versus reactive, right? So if you're working with one of us as your exercise coach and we see a series of falls happening, we're going to kind of communicate that to your doctor, maybe get back into some physical therapy so they can prescribe you some additional fall prevention strategies or assisted devices, right, to make sure we prevent those falls from happening. But our goals are centered and reflective around your priorities, your quality of life, and your goals and what you need to work on. And it's important for everyone within this care team to communicate together and seek the services necessary to help keep you strong. So let's discuss a little bit about the research on exercise and MSA. It is limited, I will say that. I have been seeking good resources for exercise and MSA over the past several years, and unfortunately research is just slower to come out with this disease, just I think primarily because of the low numbers of diagnoses or the misdiagnoses of people with this condition. But I think the one thing that we can glean from the research that has been done, a lot of them have been small case studies or just case reports on one individual, but we can also take a lot of information from the research that's done on other movement-related disorders such as Parkinson's disease, affecting similar portions of the brain, affecting similar movement patterns and symptomatic presentations. I think we can glean a lot of information from that research, and that research is very robust in how exercise can truly benefit people affected by Parkinson's disease itself. So, and one of our clients has said, and this will be reiterated later in the presentation too, this is a movement disorder and you must move to fight it, right? Exercise helps. Movement helps with the dopamine processes within the brain, helps with blood flow, helps with cognition. And so the research supports that. The research says we can continue to gain strength. We can continue to improve gait mechanics and walking ability. And mobility increasing mobility is a regularly needed thing, and the exercise bears out the importance of that. So this is one study that's been done on MSA on 10 individuals affected by MSA, and they had shown some moderate increases in strength and mobility. There's another case study out there that looks at strength training in particular and how that can help improve balance scores, improve quality of life measures, and also gait mechanics and gait speed. So the exercise literature is out there for some of these other conditions, and I think we need to take that message and kind of hammer it home to translate it to those with MSA as well.
Now let's talk about the keys to exercise for MSA. So what are some of the overarching themes that we want to make sure that we're addressing when putting an exercise program together? As we know, as symptoms and abilities change throughout the course of the diagnosis, your exercise routine should absolutely reflect that as well. So as you may be starting doing cardiovascular exercise, walking or jogging early on in your diagnosis, that has to change as your balance and stability becomes a little bit more compromised. So but it's really important to find out what and how you can change the routine to make sure that we're still addressing all of the core needs that we need to address when trying to be as neuroprotective as we can, right? So working with a qualified therapist or an exercise professional can really help guide how we change this routine up over time. So instead of doing a walking exercise, we still want to get the heart rate up. And so we can modify that to a new step or a recumbent bicycle. One of the things, our key principles to exercise that we focus on here at Movement is specificity. So again, how do your abilities and your routine need to change depending on your symptoms and your ability level? We also talk about intensity. So that intensity is one of the most important factors that all the research has kind of bared out over time for all neurological conditions and everybody in general. The exercise itself has to be rigorous enough to make changes in the brain and the body, right? So we should be sweating a little bit, we should be breathing a little heavy, and how we do that is going to have to adapt and change as your abilities change. So again, rather than walking, we're going to be going into a fast-paced recumbent bike where we don't have to worry about balance as much. All right, so those are some key factors initially in the beginning, and I think the big thing that we want to work on is we have to target the most considerable symptoms first. So what are the biggest contributing factors that affect you on a day-to-day basis? And that's what we really want to target when it comes to developing an exercise routine. So one of the things we discussed is specificity. Again, how do we modify this exercise program to reflect your symptoms and goals to try to limit progression, eliminate falls, and that's what we need to kind of triage and target first and foremost, is how do we properly address those most severe symptoms. Your home is a perfect functional training gym, right? That's where you spend the majority of your time, and that's what we really try to work on. That's what we're going to kind of demonstrate for you today, is how can we utilize your home as a gym to do the day-to-day activities that are going to help bolster your mobility day in and day out. But it shouldn't be the only outlet for you to be exercising, right? So seeking physical therapy, seeking an exercise professional, seeking a class or a space where you can become active outside of the home is incredibly important for that social interaction and that community support like we talked about earlier. Maintaining your social engagement throughout your diagnosis is incredibly important, and getting outside the house and working on exercise outside there is a great opportunity to do that. When you are at home, we want to make that the movement and then the exercise as engaging as possible. And how can we do that? We want to limit distractions as much as possible as well. So if you have cats, dogs, small grandchildren, small children running around the house, that's probably not the most ideal place for you to be trying to do your activity. So as we're going into some exercise demonstrations here in a few minutes, try to find a place where you can exercise comfortably and move comfortably, so you're not at risk for falls and you're not distracted by other things around you in the room. Biggest thing, make sure there's not a TV on, right? If you're kind of watching the television, your exercise intensity is likely going to be reduced. You're going to be distracted. So instead, what I might recommend is putting on some music you enjoy listening to, something that's going to motivate you, right? And so we want to make the exercise as engaging and as fun as possible, because we all know that if we're not enjoying what you're doing, if you don't know why or how you're going to be making benefits from what you're doing, you're not going to be as consistent as possible. And as I mentioned at the beginning of this slide, our core principles here at Movement for Exercise are specificity, intensity, and the final one is consistency. So how can we get you to be as consistent as you can while maintaining your activity? And as you'll see in the next slide, where we have a couple of our clients sharing their experiences with exercise for you, that consistency is one of the most important factors. So let's hear from them.
The only advice I'd give to others with MSA, since there's no cure, is to keep moving, keep exercising, do something. Even if it's a walk to the store in the morning, do something every day. Don't just sit around and wait for the diagnosis to overtake you. You overtake it.
How has exercise helped you manage your MSA symptoms and your diagnosis?
Well, to begin with, if I didn't exercise, my decline would be a lot faster, because I find that days that I do nothing, I tend to have more difficulty and potential falls the next day. Okay. So the exercise, it has prevented me from declining further, and I would venture to say that I'm stronger.
1, 2, 3, 4, 5, 6.
They pulled me.
Good.
And Dr. Lowe gave me good reviews, said that I'm progressing in a way that he hasn't seen in a while. It's very slow. And the third doctor was Dr. Singer, who's in charge of the clinical stem cell trial. And he was very impressed with how I'm progressing. It's at a very slow rate.
Whatever you're comfortable with, keep exercising, whether it's yoga, Pilates, working out at Movement Revolution, or in water aerobics, go for it.
Yeah, well, that is excellent. And I think that's exactly what we need to be doing when we get the diagnosis of MSA. So hearing it from you will help speak volumes to those that are going through it.
Exercise is so important to keep moving and always do something, because otherwise your legs will get tired, your feet will get tired and swollen, your arms will get tired. So keep moving.
All right, let's jump into what our primary objectives are when looking at putting an exercise program together with MSA. So we want to optimize the mobility, the strength, and balance of each client. We want to prevent falls at all costs, and we want to optimize the quality of life, and that program should reflect that as we build it up.
So when looking at putting an exercise program together for MSA, these are the different types of modalities that we're really looking to address, right? How can we make your body more mobile? How can we be helping your body move better? So when we're looking at the common symptom of bradykinesia or slowness of movement and rigidity, mobility can become a big concern. So that is one of the things that we'll go through here in a second, where I can't stress enough how important it is to do those activities on a daily basis. So we'll definitely send you home today with some good practical exercises to do for that, as well as some aerobic exercise. As I mentioned before, consistent cardiovascular exercise, whether it be on a recumbent bicycle, walking, things of that nature, things that get the heart rate up are incredibly important to be neuroprotective. And then finally, some basic strength exercises. A lot of the research on Parkinson's and MSA has focused on strength training and its benefits for balance and coordination and maintaining active mobility. Executive functioning, that's a big thing that has been studied for strength itself, and we'll give you a few basic home strength exercises that are going to be beneficial for you today. So let's dive into it.
We're going to go through each of these modalities individually with some functional practice I'll show you here in a second. But I wanted to kind of go over just the weekly recommended exercise program for someone with MSA. There are certain things we'd like you to do each and every day that can be beneficial and not be overworked. The other things we want to look at doing, 2 to 4 days a week, things that are going to get you moving a little bit more dynamically. You might need some time to recover in between. So mobility and flexibility, like we just discussed, is incredibly important. Low to moderate cardiovascular exercise, so walking outside, being more mobile in the home, maybe low intensity cycling if walking does become more of a challenge. Also very, very important to kind of keep the blood circulating and to work the cardiovascular system as best we can. It helps maintain proper blood pressure regulation and all of those really, really important things cardiovascularly. We want to build a basic functional strength program that reflects things that you can do each and every day. These are a lot of things that I'll go over and I'll demonstrate for you. Some of the more complex skills and balance drills on the 2 to 4 days a week are going to be best addressed with a physical therapist or an individualized exercise professional or in a class. So the things that we'll primarily be demonstrating today are things that you can do on an everyday basis at home. And then, other things that we want to work into the mix, which I'll show you here in a minute, is how we can integrate some of those speech therapy and voice exercises into a lot of these other movements that you already are going to be doing. Why not do more than one thing at a time and try to get the most efficient program together as possible when you're at home, rather than doing 1 hour of cardiovascular exercise, your strength exercises, your stretches, and then you do your speech exercises. Why not do them all at once? So that's what we'll kind of go through with you today. All right, let's dive into some exercises for mobility and flexibility that can be done every single day. So we'll demonstrate some from a chair and some from standing, and want to work on addressing your mobility and flexibility in almost every muscle group within your body, right? So we want to look at the ankles, knees, and hips in particular for mobility, but then we also want to look at trunk rotation, which helps you get in and out of cars better, in and out of bed with more ease. Cervical range of motion, really important for eye tracking, right? Or when doing things with your upper body, the more cervical range you have, typically the more trunk rotation you have as well. But again, these can be things that are done every single day. So let's go through a few things. One thing I recommend is finding a place at home where you have a sturdy chair, not a squishy chair, so not like a recliner. Find like a kitchen chair or maybe a chair that has arm handles on it so it's easier to get up and down if you need help with that. But find something that's very sturdy on the ground where you have some room to move around you. That setup is really important. Again, kind of limit the distractions and limit the risks of potentially having any falls by making sure the area around you is nice and clear. So first and foremost, when we're looking at the muscles of the legs, again, really important for active mobility. One thing I always stress, we're going to be kind of stretching out the hamstrings first, those muscles on the underside of your legs, which typically get really tight if we're sitting a lot throughout the day. So when you're setting up for this exercise, you want to scoot forward to the edge of the chair. Make sure the chair is not going to be too tippy as we go to scoot forward, but you want to be kind of in the upward the forward portion of the chair, and then you're going to extend one leg out in front of you. Okay, so I'll do the other leg so you can kind of see it in full view there. But I want you to try to get that leg as straight as possible. A lot of times if the hamstrings are tight, it's going to be really hard to bend the knee. So you want to make sure you get in a comfortable position where you can get that knee as extended as possible. All right, so your weight is on your heel, your posture is nice and tall. Okay, you can place one hand on your thigh or maybe hold on to the chair as you're going into this stretch. But we want to make sure our posture is tall, and we take a big deep breath in. And as you exhale, you're going to lean down, taking your nose toward that toe that's extended. And if you want to, if you feel more comfortable with balance, you can reach down toward that toe, or you can just hold on to the chair itself. I want you to go down and maintain and hold this position until you feel a stretch on the back side of that leg. Again, you might feel a difference from your right side to your left side. That's important to pay attention to. But as you're doing this, take big deep breaths in through the nose and out through the mouth. Keep breathing as you're going through and holding this stretch. I'll keep talking. So when you're here and that exhale breath, that's typically when our muscles are most relaxed. So you want to try to lengthen that exhale as much as you can and try to achieve a little bit more range of motion, maybe a little more of a lean forward, maybe more of a reach forward, okay, as you're going to do that stretch. Let's take one more deep breath here. And then we'll come back up nice and tall, okay? So as you're doing this, I think the other important thing to know is that if this is too difficult for your back, you can't get into this position, one other thing you could do, okay, sit back in your chair, place another chair out in front of you, and then you just rest the leg on top of that chair. Okay, so you have another chair in front of you, an ottoman, anything else that you can rest your leg on. It's about the same height as the chair itself. And you can simply stretch your hamstrings doing it that way. And there you might have a little more base of support to lean forward and get a good stretch in the back of the hamstrings. Again, these muscles get really tight if we're sitting more throughout the day, and really important to keep as mobile as possible. All right. So next, this is more of like an active mobility exercise than it is a stretch. It's kind of hard to stretch your calves or your lower leg muscles from this position, but it's a good way to assess and kind of maintain active range of motion in your ankles, which is really important as we go to stand up out of a chair. Place your feet right underneath your knees, all right, but not tucked back too far, because that's going to limit your range of motion. So you kind of want to have your heels right underneath your kneecaps. And from here, you want to sit up tall in your chair. You're going to simply rise up onto your toes and then rock back to your heels. Okay, so rise up onto the toes and rock back to your heels. And like we're doing right now, you can kind of go between a few different stretches. So we already stretched the left side hamstring. We're going to do some ankle mobility work, and then we'll go and stretch the right side of the hamstring. So toes up, heels up, toes up, and heels up. Ankle range of motion is extremely important for people with MSA, because a lot of times I see those ankles and the feet becoming really, really tight and rigid, and then it's hard to initiate steps, and it's hard to lift your feet as we're going to walk. So practicing this daily mobility exercise is going to be incredibly important. Okay, now let's go ahead and stretch out that right hamstring. So from this position, you're going to be extending the opposite leg you just did. Again, weight is on the heel. We're going to gently lean forward towards your toes. All right, gently leaning forward. Take a big deep breath in. And as you exhale, have a little bit more of a lean forward. Okay, inhale through the nose. Exhale through the mouth. Inhale and exhale. So these are just some guided exercise for you guys today. If you feel like you need to have more time to go back and do these on your own, I highly recommend it. Hopefully this is just a tool to help you learn these movements and integrate them better into your day-to-day activities. Next, scooting back in the chair a little bit more. Okay, if you have a chair with arms, this might work really well. I don't have a chair with arms, obviously, so I'm going to just kind of use my body as a little bit of leverage. But this is for a trunk rotation and cervical range of motion. So sitting up tall in our seats with your back off the back of the chair, that's important, okay? Get your back off the back of the chair, sit up tall. Let's take our left hand, we're going to take it across our body to the right leg, the right thigh. Okay, so your left hand is going to grab that right thigh, and then you're going to take that right hand and place it on the back side of the chair. Or you can kind of reach it down lower on the back side of the chair as well. So from here, I want you to kind of rotate and look over that right shoulder as much as you can. Okay, look and see how far you can look behind you. Try to find an object to look for. Okay, pause there for one deep breath. And then return back to that starting position. Okay, now we're going to go back and do that same side again, and let's see if we can look a little bit beyond the object that you were just looking at. Okay, so left leg over to the right thigh, right arm on the back side of the chair, looking over that right shoulder, and see if we can look a little bit deeper into that stretch, find a new object to focus on. Okay, as you notice, your shoulders are rotating, you're looking behind you in that back shoulders. Now, if you want to make it a little bit more difficult and you feel comfortable here, you can take that right arm off the chair and reach and open it up back behind you. Okay, that's going to help open up the front side of your shoulder. You might be able to like even tuck it behind your back, and that's very similar to the movement that you have to do when putting on a jacket or a coat, right? You have to rotate that arm behind you, rotate your shoulders, and get that arm in that sleeve. Okay, again, all these movements and all these stretches have a functional application. That's what's really important, to learn how you can apply and utilize these movements and stretches on a day-to-day basis, how they help you. Okay, let's go to the other side. Right hand across the left thigh, left hand on the back side of that chair, and then you're going to look over that left shoulder and try to identify an object to look for. Okay, what do we see? Hold that for a deep breath. Return back to that starting position. Then we'll go back into it one more time. Okay. Right hand across the left knee. Left hand back behind you. Look over that left shoulder. And breathe. Good. Let's return back to that starting position. Obviously, if you feel that's really tight, I do recommend you hold it for a longer period of time. We just don't have time for that today. Okay? I usually recommend anywhere like 5 to 7 deep breaths per stretch. If you have more shallow breathing, maybe you go for 10 breaths. But counting your breath is a little bit easier and more relaxing than it is just holding it for a certain number of seconds, where you typically will hold your breath, especially if the stretch is pretty intense. Okay. The next one is going to be standing. If you don't feel comfortable standing, just kind of repeat some of those exercises we just did. This is a great exercise that you could do at the countertop at home or against a wall. I'll show you 2 different versions of this. I'm going to use the back side of the chair as an option, but we want to stretch the muscles of the calf, right? So again, like I mentioned before, that ankle range of motion and dexterity, really, really important for maintaining movement, especially as you go to walk or step. We want to make sure we're clearing those toes. And if the back side of your leg is really, really tight, it's going to be a lot harder for you to do that. So with a sturdy surface, either a wall or a very sturdy chair, like the back of a couch, or a countertop, you can place your hands on the countertop. You're going to take a step back with one foot. Okay? When you step back with one foot, you want to make sure you have a wide base of support with your feet. A lot of times those feet want to come close together, and that's going to be very challenging under balance. So make sure your feet are wide, and that back heel is pressing into the ground. Okay, so we want both feet flat on the floor whenever possible on this stretch. Okay, as long as that back heel is down on the ground, you can kind of bend the forward knee forward toward the counter, toward the object that you're leaning on, and that should intensify the stretch on the back side of the leg. So we want to get as much of an angle from your foot to your lower leg as possible. That's going to stretch out the back side of your feet, or the back side of your calf, sorry. Okay, hold that again. 5 to 7 deep breaths. depending on how deep you breathe. Okay, let's walk it back. We can switch sides. Okay, grab onto that object, take a step back with the other foot. A lot of times those ankles will want to turn, like the heel will turn in. So try to make sure that those feet are kind of like parallel to one another, so that heel's not turning in too much, because then you're not going to get a good calf stretch. Make sure that heel is kicked out, then press that heel into the ground. Lift your chest, and then bend and flex forward, I should say flex forward toward the object that you're leaning on, right? So you're maintaining that back heel on the ground. So you feel stretch on the back side of whatever leg is behind you. Okay, again, hold it for a couple deep breaths, and then come back up nice and tall. All right, that's a brief kind of tutorial on mobility and flexibility exercises for MSA. I hope you find that helpful. Next, we'll go into some more strength training and mobility exercises.
All right, let's start working on some functional strength exercises. Again, these can be things that can be done on a daily basis. We'll demonstrate some from a seated and standing position, as well as a lying down position for today. So I don't necessarily recommend or would like you to do these exercises on the ground with me, just kind of demonstrating where you can do them on your own, preferably on a bed or lying down on a couch. All right, so let's go ahead and get set up over here. I have, again, the sturdy chair that we just used for some of those other exercises that we were working on. I'm going to use for our first exercise, which is a sit to stand. All right, so a basic exercise that is obviously very functional and important to everyday activity, right? Something that's commonly pretty difficult for people with MSA is getting up out of a chair, right? So you can use a chair with armrests. Again, we kind of want to use one that's pretty firm and sturdy, one that's not going to tip on us, one that's not too squishy or too low. All right, so that is an ideal situation. But the big things that some of the mobility exercises that we just worked on are going to directly carry over into helping us perform this sit to stand exercise better. All right, so from here, you're going to want to make sure you're positioned well before we even go to stand up or attempt to stand up. Body positioning on the chair is really, really important to go to before we get started. So you want your feet about hip width apart. All right, so kind of I like to say use the width of whatever chair you're at. If it's like a kitchen, like a dining room table chair, kind of get your feet kind of on the posts, just outside the front of the posts of that chair. Okay, we want to be scooting forward toward the edge. If you're too far back, it's going to be really hard to overcome your body mass at your hips and your midsection to get yourself up and off the chair and use the muscles in your legs. So scoot forward towards the edge of that seat. Okay, sit up nice and tall. Wide base of support with your feet. You want your heels tucked just behind your kneecaps. Okay, so you don't want them significantly tucked back, just slightly behind the kneecaps. That's going to require some ankle range of motion and mobility. Again, something we just worked on, right? So another exercise that is going to be coming up is focused on kind of some boxing techniques to reach and lean forward. That's going to help you with the sit to stand exercise. Okay, but because that forward lean is really, really important to help get our body weight forward over your feet as we go to stand up. So if you need to use your arms to push up off the chair, you can do that. Okay, once you go to stand, if you need something to maintain your stability like a walker or something to hold on to out in front of you, you can either do this by you have your walker in front of you or have a kitchen counter or another chair out in front of you to hold on to as you go to stand up. Okay. If you need help standing, make sure there's someone there next to you to assist. So we're in a good position. The mindful intent and the effort behind getting up and out of that chair is one of the most important factors. If this is a difficult exercise for you to do, and if you think about how difficult it is for you, guess what? It's going to be a lot more difficult. So we have to think about being powerful. We call these power-ups, right? Because it's not just a sit to stand. It's not just a squat. It is a power up. We have to generate as much force and as much power as we can to get our bodies off of the chair, okay, or the seat. So you can use your hands if you need to. I'm not. I'm going to put my hands on my thighs, or you can kind of reach your hands forward. We want some momentum to be forward, and then we have to drive straight up. I kind of relate this to like a ski jumper, right? We kind of want to lean over our skis and then we're jumping with a lot of power up and out of that chair, okay? So that's the idea. That's the intent behind it. We have to move with intent. So we want to lean forward in your chairs, either push off your hands or reach them forward. That's going to get more weight over our feet. And on 3, we're going to power up together. Ready? 1, 2, 3, power up. Now, as we get tall, we might be a little bit tippy on the heels or the toes. Body weight might be coming forward like this, okay? You want equal pressure, heels and big toes, to stand up. If you're losing your balance forward, if we're too heavy on your toes, you have to sink your butt back and get weight on your heels. If you're falling back into the chair, okay, you need to pull your hips forward and put more weight on your toes. Okay, so that's kind of how these different, how we control that body's momentum as we go to stand. A lot of times with MSA, we're either too far forward on our toes or too far back on your heels, making this exercise really difficult, especially once you get to stand. But trying to get your feet as flat as you can and knowing how to adjust is really, really important. Equally as important is when we go to sit down. We have to control our body's momentum. You're sitting down, momentum is going backward, so we have to counterbalance that by reaching forward. So as we go to sit down, reach both hands forward. If you need to hold on as you go to sit down, you can reach one hand back, but make sure the other hand is reaching forward. You're bending at the knees, keeping your feet flat on the ground, pushing your hips back, and sit down as slowly as you can in control. Okay? Let's do that 3 more times. Okay? So we're going to get ourselves in a good position on the chair, forward on the chair, feet wide. We're going to lean forward and power up on 3. Okay? 1, 2, 3, power up. Get up nice and tall. Either tuck your hips underneath you or sink the hips back depending on how you need to correct your balance. And then as we go to sit, one hand forward or both hands forward. As we sink down, bending at the knees, bending at the hips, and slowly making your way back into the chair. Okay? Let's go up on 3. 1, 2, 3, power up, nice and tall. The more you do these, the more practice you're going to get kind of finding your ability to stand and maintain your stability at the top of that stand. Because you're never standing up and just, unless you're doing this for exercise, which you will be doing. Okay, we're typically, from a functional perspective, you're standing up to go do something, right? You're going to walk to the kitchen. You're going to walk to the bathroom. We have to get our body ready to make that next step. And if we're too far forward or too far back, you can't make that next move with stability. So you've got to find stability at the top of every single stand. Okay, that's incredibly important. Let's sit down nice and slow, reaching both hands forward, bending at the knees, bending at the hips, pushing your butt back, and in control. One last time. Let's perfect it. 1, 2, and 3. Big power up, nice and tall. Good. Squeeze your hips, lift the chest up, lift those eyes up, and let's sink down nice and slow. Okay. Reaching the hands forward, bending at the knees, bending at the hips. Great job. Okay, the next one is going to be a standing exercise. So guess what? You get one more sit to stand. Let's power up, nice and tall. Okay, and you can use, again, something that you can feel very sturdy with. So this could be the back of a couch. It could be a wall. It could be a countertop. This is just an upper extremity strength exercise. So the sit to stand and the squat is primarily lower extremity strength. This is to help open up and try to strengthen the upper body. Okay, so I'm going to use the wall for the purposes of today. Okay, so you're going to want to have the arms about shoulder width apart. This is just a wall push-up. Okay, so this is just really important if you do find yourself having to push up off a chair or pushing off the ground as you go to get yourself up. This is a really important functional movement to be able to press your body away from something. Right? So find the wall, find a countertop. Arms are going to be about shoulder width apart. No matter where you are, actually, the farther you walk your feet back, the more tension and strength you're going to require in the arms and the upper body to push yourself up, okay? So from here, you're gonna walk your feet back a little bit. Try to keep your feet, try to start closer. Do 1 repetition. If it's too easy, you can always walk your feet back. The big thing with this exercise is when you're finished, you gotta make sure you can lift those legs back up to get yourself up again, okay? So let's walk the feet back. Again, with your feet, we want about shoulder width apart. Our chest is up, kind of looking at the hands, okay? And now we're going to slowly lower your body and your head toward your hands, and then you're going to push away with as much power as possible, okay? So you're going to inhale as you come down and exhale as you push away. Let's do 3 more of those. Inhale down, exhale, push. That's 1. Inhale down, exhale, push. There's 2. Inhale down, exhale, push. That's 3. Nice job. Walk your feet in. Keep a good wide base of support. Okay? Let me show you one more here at the wall, actually, that I think is going to be really beneficial. It translates right into walking or core strength. As we just worked on with that sit to stand, right? Once you're standing, we got to be able to initiate a step. And as we demonstrate kind of in the next series of exercises with some of our cardiovascular exercises, rocking and weight shifting is really, really important. That's how we initiate a step, right? So from here, with your hands on the wall or at the counter, this is a very secure position to be in, right? If you tend to lose your balance going backwards, make sure you have a chair behind you or there's someone there to help you to make sure we're not going to lose your balance going backwards. This is all about lifting your legs. It's going to be a standing march, okay? So initiating those muscles in your abdominals, your hip flexors to initiate a step. So your hands are nice and strong, feet about shoulder width apart. You're going to pick one knee up to your chest and then push it back down. Shift your weight into that leg and lift up the other leg. Lift up, push it down. Lift up, push it down. I emphasize that pushing down because that leg has to come back down to the ground. You have to shift your weight into that leg so you can lift the opposite one. No different than when you have to take a step. Shift the weight to one side and drive that knee up. Okay, a lot of times when we go to walk and we try to initiate steps, we're just thinking about our feet, but it starts with a weight shift. And this is a great way to help practice that. That shift has to go from your hips down into your feet in order to lighten up the load on the other leg so it can lift up. All right, as you practice this, as you get stronger, you should be able to practice lifting that leg up a little bit higher. All right. Lastly, I'm going to demonstrate a couple exercises from the mat, from the ground. These can be done on the bed when you get up in the morning, or you're taking a nap throughout the day, or maybe at night before you go to bed. Great for hip extension, core strengthening, and trunk mobility. Okay, so again, if you're not comfortable getting down to the ground and back up again, I do not recommend doing these on the ground. Find a more elevated surface for you to complete these. Okay, but when you're lying in bed, you want your feet to be knees bent, feet about shoulder width apart. Okay, so as we go to initiate that stand up and out of the chair like we just practiced, the hip hinge, the hip movement itself is a really important thing for us to become better at. And that becomes really, really tight and rigid commonly with MSA. So this is a very foundational exercise that you've probably done in physical therapy if you have done PT, but one to practice at home. And here's what I want you to try to practice. And relating it back to that sit to stand, if you tend to be more forward on your toes as you go to stand up, if you tend to be more forward on your toes when you go to stand up, I want you to dig your heels into the ground for this exercise. So you're lifting those big toes up. What that's going to do is help you to utilize your hamstrings and your glutes as you go to stand. And it's going to teach you how to get weight on your heels and use those muscles as we go to stand up. If, when you stand, you fall back into the chair, okay, you're not getting enough weight into your toes. So if you're one of those folks that falls back into the chair, I want you to push heavy down into your toes as we do this exercise, okay? That's just a different point of emphasis I'd like to point out. So from here, your hands are going to be resting at your side. You're going to push through your feet, either your heel or your toe, and lift your hips off the ground or off the bed. Okay? And then you're going to slowly lower back down. You're going to exhale as you go up. Get as high as you can. Squeeze your hips, squeeze your bum, and then slowly come back down. Okay? You're trying to drive up, and you should feel this in your bum, your hamstrings, ideally not too much in the lower back. Okay? But that might be happening a little bit. You want to go up as high as you can, and then slowly back down. So that's called the hip bridge, something you can practice there on your own. Last exercise I want to show you here is going to be what we call a windshield wiper. This is just a good core. It's actually more of a mobility exercise as opposed to a strength exercise, but great to do from the bed. You're going to be arms out to the side. That's going to help open up your upper torso. You're going to take your knees from one side to the other side. A lot of times our trunk and our hips get really rigid and tight. This is a great exercise just to keep those muscles more limber and more loose. Okay? So just rotating the knees from one side to the other. All right? Great. All right. I'm going to slowly come up. That's just a kind of a basic at-home strength exercise routine that I hope you find helpful.
All right, let's go over some everyday exercise on seated, low to moderate cardiovascular exercise. So how do we get the heart rate up if we don't have access to a recumbent bike or kind of a treadmill? All right, those things are difficult. Here are some basic things that you can do from a seated position to really get your heart rate elevated. So outside of this, if you do have access to a recumbent bike or you have a place where you can go and exercise, I highly recommend you seek out a low-cost gym membership to simply just go ride a recumbent bicycle. I can't stress how important it is to get your heart rate up on a regular basis, and those are great ways to do that. These are just some things that you can do on an everyday basis when you can't get to the gym. But let's get set up here. So again, similar to our stretching exercises, we're going to want to find a place where we can move freely and securely, right? So one of the things I also wanted to bring up is one of the symptoms that we discussed was some difficulty with ataxia, or those involuntary movements and motions that are hard to control with your upper body or your lower body, right? That might affect how you can effectively kind of reach for objects, right? Or it might affect how you step and be able to control that step. So that ataxia might be, as you go to initiate step, that leg is kind of swirly and it's hard to get that leg planted on the ground. Same thing as you go to reach for an object, your arm might be kind of moving in a way that you can't necessarily control it as well. One tip and trick that I might recommend for someone going through that is the utilization of some ankle or wrist weights. Anywhere between 2 to 5 pounds, depending on what your ability level is, can be helpful in managing that ataxia to kind of calm it down or give you a more sense of grounding as you go to do your exercise. I don't necessarily recommend wearing these around the house on a day-to-day basis. Talk to your local healthcare professional about the idea of doing that. But as you're going to exercise, if you can do this safely with a partner, it can be extremely effective helping you manage that ataxic movement pattern a little bit better. So I'm going to put the ankle weights on my legs today. Okay, you want it to be pretty snug around the base of your ankles. Okay, not only will this help with the ataxia symptoms, but it'll also help you get your heart rate up a little bit more because you have more weight and more resistance that you're fighting through with any of the exercises and activities that we do. All right, so a little dual benefit there. So again, these are exercises that help with kind of walking around the house. I'll give you a tip and a trick on how to do that a little bit better, but then also just getting your heart rate up from a seated position. And a lot of things that we do from these positions will help translate into how we can walk and move better. All right, so basic exercise here. Get a comfortable spot in your seat. Okay, we don't want to be leaning back on the chair. Our tendency is going to want to do that, but we got to sit up nice and tall. Use those core muscles. Get as tall as you can through your torso. All right, and now from here, let's just go into a high knee march, that active hip flexion. Let's start nice and slow, right side and left side. What I like to do with all of our clients is make sure that you're aware of what muscle groups we're working and how they apply to making your movement better. All right, so right now we're working our hip flexors. You should probably feel it top side of the thighs, right inside of the hips, maybe in your midsection of your core a little bit. If you're sitting up tall, okay, your back is off that chair, it's forcing you to use those core abdominal muscles. Extremely important when you go to initiate a step, right? And this is essentially what we're trying to do. We're initiating a step, all right? This is how you initiate, okay, to take a step forward as you go to walk, right? But before we even do that, so let's go 5 more here. 1, drive those knees up nice and high. 2, 3, 4, and 5. Before we even go to initiate a step, we have to shift our weight first. So in that chair, make sure the chair is not too tippy, but we're going to kind of rock and reach from right side to left side. Okay? So what we're doing as we're doing this is we're shifting our weight. You're moving your torso and your trunk. If you can kind of think of an object to try to reach for as you go from side to side, you really want as much lean as you can control as you go side to side. When I'm going to my left, I'm reaching for the wall. When I'm going to the right, I'm reaching toward the other wall. Okay? So you want a lot of lateral lean here. As you will feel, if you're leaning enough, you're kind of automatically shifting your weight through your hips. Right? As I reach to the right, all of my weight is over on my right leg. As I reach to the left, all of my weight is over on the left leg. Okay? What do you have to do when you walk? You have to shift your weight and fully shift from your right leg to your left leg. Same thing, it all applies, right? We'll apply that as we go to take a step. Also, one other thing that this motion helps with a lot, so keep going, don't stop, okay? We're going to stay moving here, okay? So what this is going to do is also help you scooch forward in your chair, okay? If you're kind of glued to the back of that seat and it's hard for you to move forward, rock side to side, okay? And then progressively kind of scoot your bum forward to the edge of that chair. Okay? Another good benefit of this side-to-side rock. Let's go back into a march. Okay? Now let's get the arms and the legs going with the marching. Okay? Anytime you can work the arms and legs together, it requires us to be more cardiovascularly engaged, right? You're activating a lot more muscles as we do that. If it's hard for you to coordinate that opposite arm, opposite leg, okay, break it down and just go one at a time. Go slower, okay? Try to get that movement in the upper body and the lower body working together, okay? Or if it's hard to work them together, you can do the leg first, then the arm. The leg first and the arm. The leg first and then the arm. Leg first and arm, okay? Let's keep marching those legs. A lot of times, one of the things, like the Rock City boxing program that we mentioned earlier, but boxing in general, it doesn't have to be rock steady. Boxing with someone who knows how to work with someone with MSA can be extremely beneficial for hand-eye coordination, tracking, but getting your heart rate up and getting you moving more dynamically. Let's demonstrate that a little bit here. Okay, so let's rest our feet down. Your hands are up. Okay, posture is really important. So lift those hands right up by your chin, and then we're going to reach one hand forward. But what I like to do when we're not actually hitting something, hitting a bag, okay, we want to open those hands up as you punch forward. Okay, so we're going to punch forward with the left hand, punch forward with the right hand. Left and right. Left and right. Try to get a little of that side-to-side lean and rock as we throw those punches from left to right. Okay, open those hands up, reach and try to get as much forward motion as possible. Okay, as much forward extension of that arm as you punch it out. Now see if we can punch a little bit harder, a total of 10 times. Now, we talked about incorporating voice into a lot of these exercises. Okay, let's be as loud as we can as we count out these 10 punches. Are we ready? Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good. Let's come back to a march. Relax the arms. Okay? So as you feel, the heart rate should be elevated. Okay? That voice control helps kind of elicit a lot more response, right? So it all works together. Work it with me here. Now this next one, we're gonna reach and rotate from side to side. We're gonna count out 10 of those. This time the punch is across your body, okay? Punching across your body as we go. Excuse me. Okay, let's do 10 of these. Hands are up to start. Ready? And 1 with the left, 2 with the right, 3, 4, be loud, 5, 6, 7, 8, 9, 10. Let's go back to 10 more punches out to the front. This is going to be helpful when we go into some strength exercises in a little bit. Okay, so we're going to punch forward, and I want you to lean forward as far as you can as you punch. 1, 2, lean forward. 3, come back tall. 4, come back tall. Reach. There's 5, 6, 7, really lean forward. 8, make sure we're coming back up tall. 9, and 10. Very good. Nice job. Hopefully your heart rate's elevated a little bit. I wanted to show you one functional walking exercise that I think is really important and valuable for everyone to practice at home. A lot of times we're thinking about taking bigger steps, right? We're thinking about trying to optimize your gait pattern as best we can. And you might do that well when you're in physical therapy or when you're in an exercise session, but how do we translate that to the home? This exercise hopefully should help with that. So, as you can see, I have a cone out in front of me here. What I want you to do is, if you're comfortable standing, this is a good exercise to do. If you're comfortable walking, this is a good exercise to do. If you need an assisted device, please use it, right? Whether that's a walker, a cane, use those devices as you do this exercise. Have someone with you, okay? But I'm just going to demonstrate how I would coach someone to do this exercise. Okay, so first things first, we have to stand up from a position wherever you are. And so at home, you can pick, maybe it's the dining room chair to the bathroom. Okay, so this is a functional mobility exercise. How do we get moving better in and around the house? So start at a place where you commonly sit, dining room chair, right? Stand up from that chair. You're going to walk to the bathroom. Right now, my goal is just to walk to this cone, around the cone, and back to the chair. Okay, so it doesn't have to be a big distance. It's just one way for you to be more mindful of how your step performance is day in and day out. So what I want you to do is just walk at your normal speed and count how many steps it takes you to get from where you started to where your destination is, or from where you started to a destination and back. Okay, so total number of steps. Every step counts, including the turns, as you get back to the chair. Okay, so I'm going to count it out loud. I'm going to walk around the cone, come back to the chair, and stop here. Okay, so it's going to be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, so 15 steps. My goal next is to do that exact same movement, that exact same pattern, and reduce the number of steps that I take by 2. All right, so my goal is now 13 steps. Count it out loud together as you're doing this exercise. Count every step out loud. So what we're doing is try to lengthen the length of the step itself and to make those steps more efficient. Okay, here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Awesome. I got there in 12. Okay, I beat my goal, right? Sometimes that may happen. The whole objective here is to try to find how efficiently and what is the proper number of steps for you to get from point A to point B. All right, so the goal is not to reduce every single time. The goal is to find out how big of steps can I take and how can I calibrate and kind of come back to those steps on a daily basis to let myself know how good my quality of step is. Okay, so that's the goal here. Again, I have the ankle weights on, which might help some of that foot ataxia as you're going to take a step. So those are some different everyday examples of how to kind of get the heart rate elevated and then also be more mobile day in and day out as you're going to exercise.
So I hope you've enjoyed this presentation today. I wanted to leave you guys with a few resources on how you can become better educated, as well as become more active with MSA. The MSA Coalition is a wonderful organization that obviously is presenting this presentation for today, and they provide such great advocacy and awareness and education resources for the MSA community, so please check them out. If you guys are interested in any at-home virtual-based exercise services, we do offer those through Movement Revolution. If you're seeking some professionals in your area, we're also able to help identify who some qualified and specialized physical therapists might be, or exercise programs in your area. So we want to be here as a resource for you, whether you're in the Chicagoland area or elsewhere. We hope this presentation and these demonstrations all help you, arm you with the resources to help you move a little bit stronger with MSA. And thank you so much for your attention for today. If you have questions regarding anything that was discussed in the lecture today, feel free to reach out to us here at Movement Revolution. This is our direct line here in Chicago, as well as an email address to get a hold of us. If you would like any more information, that's our website listed below. Again, thank you so much for your time and your attention today. What we like to say at Movement is think big, move strong, never quit. Have a wonderful day, and we hope to talk to you soon.